Hi everyone, Elizabeth Scala here with Living Sublimely Well. Today I want to talk about therapy and the staff at physical therapy or occupational therapy. So if you found this video really briefly, I've had elbow surgery over a year ago. And after my elbow surgery, I went to occupational therapy. My surgeon called it physical therapy. They're very similar. It just depends on what the person, what type of certifications they have, and it varies state from state. So PT, OT, okay, physical therapy, occupational therapy. But I went to OT for 6 months after elbow surgery. And the first 4 months, I was going 3 times a week. And so I got to know the occupational therapy staff very well. And oh my goodness, my home away from home. I loved the place I was at. I was so grateful for my care team. And I became really close with the people in the office, especially the students, now graduated and working. Anyway, but I wanted to talk to you about the staff, how there are people too. So as I mentioned, I went to therapy 3 times a week, and 2 times a week I saw one therapist, Candy, and another time, my third visit, I would see the other therapist that worked in that office at the time, Tara. Well, and Ron, my neighbor, was driving me, so he had a big blue truck, and I'd hop up into the truck every morning. My therapy sessions were in the afternoons, like early afternoons. So I say morning because we had to leave about 45 minutes before. That's how far the drive was. So it happened to Ron's truck and we'd take the drive down the road to therapy. And so we had lots of time in his truck having many, many chats about a whole plethora of topics. He became a very good friend of mine. And I'm forever grateful for his assistance. So it's interesting. And Ron would either do some errands while I was in therapy. Sometimes he'd go to his own appointments. He'd make an acupuncture appointment, which I thought was great while I was in therapy. Other times he'd just sit in the parking lot and make phone calls or catch up on reading, or he'd even take a nap. Just depended on what he had going for that day. And there were times where I'd be in the therapy office for a very long time. We're talking 90 minutes to 2 hours, and Ron waited for me. And then there'd be some times where I'd pop out of the office in less than 60 minutes. And Ron started to notice this trend and this kind of pattern, and I noticed it too. I was like, well, going in for my short day. So what was interesting to me, and this is where I'm going with the staff at therapy, what's interesting to me is Candy, her therapeutic style was very educational, was quite motherly and like caring and supportive, giving me tissues when I was crying or consoling me. She was cheerleader-like, so she rooted me along, push, 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 go, 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 trying to get me just to move a few more tiny centimeters. That was her style. That was her professional approach. That was her therapeutic touch. On the other hand, Tara, the other therapist at the office, was much more what I phrased as mechanical. We would go through the exercises. She would do the massage and have a good day. It was quick. There was no measuring with the Goni about how much my arm would move. There was no long chats and conversations about what was going on. It was very minimal. And like I said, mechanical. Just move your arm, do the things. Okay, you're done. And for a while, I almost disliked my days with Tara because I was like, am I getting therapy? Is this helping me? Am I getting what I need? Now, I don't dislike her. I don't dislike it now. Here's where I'm going with this. I've come, and then we had a shift. One day, still kind of in her usual therapeutic way, brief, short, less chatty, asked me what kind of music I like. And I mentioned I'm into jam bands. My favorite band is Mo. You never heard of them. Okay, it's this, that, the other. She wound up putting one of my favorite bands, Twiddle, on the music player that was in the OT office that day. And we were listening to it as we were going through the exercises, me and all the other patients in our family style room. And the more that I started to feel a little bit better, the more conversation Tara initiated with me. The explanations of why one day she wanted to stretch me. The therapist would always stretch us out at the end of our session. She wanted to stretch me lying down versus sitting up, seeing about if gravity would help. So I started to shift from disliking this mechanical approach to noticing that each therapist has their own style. Each therapist brings talents, expertise, eyes, hands, feeling, and sensations to the patient. And instead of thinking, oh, I really want to be with this therapist all the time, I really like going to that particular therapist, I want to see them for every session, it's a benefit to you, the patient, if you do have more than one therapist placing their hands on your elbow, feeling your joint, assessing your progress, using their eyes, their ears, their skin, all of their senses to help you. So, and it is in the book, I call Tara the mechanical one, and, I would tell her to her face when I talk to them and see them and share the book with them and all. But you may have a therapist that has a different approach or style, and you may have a therapist you like a little bit better than another therapist. But it is good to notice that these different styles are all helpful for you. In fact, with time and reflection, I have received the gift of knowledge that I believe Tara was very intuitive. She sensed when I was feeling my worst and didn't kind of stimulate lots of chatter, because that was just where she was. She was letting me be, letting me, sit with the pain, because that's the other thing. With Candy, she kind of would back off if it hurt and okay, let's try something else. But with Tara, we would push through that pain, and I would be really hurting the days after working with her, which on one hand might have been good to have a little bit of mixture, to really push the elbow versus allowing it to be where it's at. So I feel like a positive I've received, I realized, is she was very intuitive. And then the days where I was starting to feel a little bit better and coming out of my shell, then she intuitively said, hey, what music do you like? And we had great conversations, albeit after that. So your therapists, if you have more than one, may have different styles. You may think, I don't really like seeing that person, or, oh, is this even helping me today? All the different styles are there to support you. If something's really not working, as I've said in other videos, speak up, advocate for yourself, but give it a chance. Each therapist is a unique, dynamic individual, I'm sure, and each has strengths and opportunities for growth. And the strengths they bring allow you for a very mixed bag of support so that you're receiving all the benefits that you can get from therapy. So hopefully this was helpful, something to think about as you go to your next PT, OT session and you think about your treatment team. Look for the good in each of your therapists, and I'm sure you can find at least one thing. They're all there trying to get you better and help you heal. So thanks for watching. Visit me over at elizabethscala.com. I've got some blog articles, other videos, some resources there for you, and opportunities to serve you. We'll see you next time. Take care.